So I'm going to start talking about male fertility. So why am I talking about male fertility as a GP? I probably have a degree of ADHD, and therefore I have no ability to keep a job for longer than 6 years. So I've moved around quite a lot. I've been a school teacher, I do male sexual function, I do male health, testosterone deficiency, and now male fertility. I've been lucky enough to do a podcast on sexual pleasure, and I've done a nice bit of TV, which is just fun to do and silly, and you actually get bought lunch, which you don't get in general practice. If you do have any questions, as I've said, stick them in there. So why are we talking about fertility? Is this just a little bit apocalyptic? Well, actually, the Spermageddon could be coming. If we follow, hurrah, it's working. This is Levine 2016. So actually, there is a journal behind this. Average sperm counts have dropped since 1973 by 100 million per mil down to 47 million per mil. The level at which men are generally functionally infertile is about 20. So we're approaching functional infertility before 2045. I don't know if you've ever seen the film Children of Men, but it's kind of starting to feel a little bit like this. So this is correlation, not causation. I know that's important. As the red line is showing total sperm count, not concentration, falling over time, you also can see the amount of plastic going up in the world. And I think pollutants, environmental concerns are generally behind what's happening to us. So a little primer about male fertility. Why am I talking about it? I had the privilege of being a presenter on a TV show about male fertility, and I knew nothing about male fertility, from how to badly read a semen analysis in general practice. So I had to do a quick learning cycle with that, and then very kindly, the guy that ran it was the medical director, Jonathan Ramsey, asked me if I wanted a job. And so I now have a job in male fertility, and why the hell I have had to learn it very quickly. So let's talk about sperm production. Your testicles make 1,500 sperm per second. Your sperm cycle of an entirely new batch is 74 days. Your testicles are purely factories. They make testosterone, they make sperm. They just do two things of real use. So you've got production, then you've got transport. The sperm has to get out there. So you've got to be triggered by sexual arousal, or you can use high frequency sex toys if you need to, for example, in people who've had spinal cord sections. Finally, the sperm function. You need the nutrient broth, I know that's a disgusting phrase, of the seminal fluid to feed and to neutralize the vaginal fluid. So, male fertility and age, you can just see at the bottom here, you're at your peak in your 20s to 30s. It declines after 30. By the time you hit 50, it is half as good as you were at 30, and there's half as many. So actually, it's similar for men. Their fertility is falling because we're starting from a lower base level now. What are we talking about? What are the causes of male infertility? There's plenty of them, but there's lots of them that you actually discuss in general practice all the time. Lifestyle is key. Obesity, smoking, alcohol. Chemotherapy, if someone has had that for any reason at all. Infections cause increased oxidative stress, and the inflammation damages sperm production. If we have undescended testes, so for example, they had to be brought down with an orchidopexy when we were born. If you've had previous mumps outside of childhood, and if you've got a genetic condition like Klinefelter's, which is kind of 1 in 600 men. And then finally, idiopathic, which is our way of saying, I don't know, which is unfortunately the majority of our patients. And then, is there a surgical cause? Is there some obstruction in the areas of the epididymis or in the seminal outflow tract? Is there a problem with that? So why do we do a semen analysis? Why does it help? Because it lets you work out whether the fertility issue is due to male factor. And if it is there, how bad is it? And do they need referral? So first thing to start with is sperm count goes up and down. If you had a long flight from a hot country, you will have baked your testicles. Your sperm count will have dropped dramatically. So going on honeymoon to Bali, you're not going to make a baby probably for the first 3 days afterwards. Okay, so give yourself time to settle. So the limitations of semen analysis, there's big biological variation. It'll go up and down. So that's why always do a confirmatory semen analysis a week or two afterwards. If you've got very low concentrations, you're going to get a sampling error, and also the buggers move. So actually it can be difficult counting them and making sure you've got correct numbers. So always repeat. Now, when I was looking at them, I kind of got there were three things I was mostly looking at: numbers, shape, and swimming. However, there's a few things that we should be looking at. The ejaculate volume should ideally be over 2 mil. Remember, sperm is only 1 to 5% of your seminal fluid. The rest of it is the nutrient broth with fructose and various other nutrients that are so important, zinc as well. Your sperm so if you've got less than 0.5 mils, that's usually because there's a blockage, and therefore it's not coming out properly. So that would then go to your urologist. Or it's going backwards, and you've got retrograde ejaculation, and then potentially you need to go to the urologist as well. If they mention they've got cloudy urine after having sex, that gives you a guide that maybe it's going backwards. Sperm concentration should ideally be over 20 million per mil. If it's less than that, 5 to 20, it's going to take longer to get pregnant, but you might still be able to do that naturally, but you should still refer. If it's under 5, that's severe oligozoospermia, and you really should refer because it's really difficult to conceive naturally. Total motility should be over 40%. You need 40% of swimmers. Ideally, progressive motility, which means they're moving in a line rather than just swimming around in a circle, which isn't very helpful, should be over 40%. If it's less than that, again, 20 to 40, they might conceive, but it'll take longer. If it's under 20, really not great. Please refer them. Remember, you're generally going to be doing a follow-up one, so it's on average. Finally, morphology. Morphology is a subjective reading, so it really depends how good the person doing the review is. So it's operator dependent. Over 4% is normal. But remember, if you've got 4% of 10 million, that's very different to having 4% of 50 million. So the numbers also matter. Now, the main three we're going to focus on just for a second are concentration, motility, and morphology. If you have a problem with just one of concentration, motility, and morphology, you have a 3 times increased risk of infertility. If you have 2 of them, you have a 6 times increased risk of infertility. If you have all 3, you have 16 times increased risk of infertility. That's why they matter. Finally, so there's kind of 5 things that you need to focus on, is evidence of white cells, round cells, or debris. If there's that in the semen analysis, often we don't get those, but some clinics do provide this, then that is a sign there may be some inflammation from an infection going on, and therefore it's important to test. I was taught, and maybe I was just stupid and didn't listen really well because I was hungover or something, but I thought that the urinary system and the reproductive system were sterile environments, and that's why your urine sample should always be sterile. I was wrong. It's got a massive microbiome full of thousands of different bacteria, which in general are very positive for you. They're a complex ecosystem, viruses, bacteria, fungi, that maintain genital health, they influence sperm quality, and they protect against infections. So, if you have an abnormal microbiome, that's a problem. So we need to be thinking about that. The problem is the evidence on microbiome and our understanding of it is in its infancy, so we don't have full information about that yet. DNA fragmentation. Again, we're not testing this, but you may get someone coming in with a report saying, my DNA fragmentation was 60%. What the hell does that mean? Now, that's something we should talk about. So it's not enough that we have a beautiful looking sperm with a lovely moving tail. The genetic payload needs to be good. What happens is, unfortunately, with DNA fragmentation, there are significant breaks in the genetic material. Why does that matter? Because these breaks are associated with low conception rates, poor embryo development, high miscarriage risk, and low live birth rate. And let's be honest, the whole point of fertility is to get a live, healthy baby. It's not about the number of times you got pregnant. That really doesn't count. And that is really distressing for people because they want the outcome at the final end. So, if we look at IVF rates have not improved in 40 years. They've always generally been, if you have good quality sperm and an egg, a decent egg, 30% likelihood of having a live birth each cycle, all right? We only allow in some areas 1 cycle, so you've got a 1 in 3 chance of actually having a live birth. If, however, you have, so the green is low DNA fragmentation, the red is high DNA fragmentation. If you have high DNA fragmentation, your chances of having a live birth fall to 12%. And then you get 1 go. So it's an absolute outrage. People are not testing DNA fragmentation before they have their IVF cycle. I think it's absolutely outrageous. I'm going to breathe before I get angry. But just in case you need to interpret it, there are multiple reasons why you might get it. And that's a lot of this is lifestyle. Huge amount of lifestyle. I'm going to focus on 3 in particular because otherwise we'd be here all day and we've only got another 19 minutes. Smoking. We know that smoking, including vaping, is associated with high rates of DNA fragmentation. Just don't do it. high intake of caffeine, drinking more than 3 espressos. Now, let's be really clear. A Costa coffee contains 4 shots. All right, so drinking more than 3 espressos, so single shots of caffeine, is enough to reduce your increase your DNA fragmentation and reduce your fertility. Finally, varicoceles. Varicoceles are really important. 40% of men in infertility clinics have a varicocele. Only 15% of men in general have a varicocele. So clearly the extra heat that's providing is cooking the testicle, damaging sperm production, damaging genetic material, and then that's crucial for embryo development. So what are the common tests? There's mainly 3 of them. SCSA and tunnel are used when you've got lots of sperm. But if you don't have that many sperm, you use COMET, because COMET's better at low levels and low numbers. So you may get different. Look, I don't expect you to be reading these assays and to be necessarily understanding them. But if someone's gone and got a DNA fragmentation test and it's high, you shouldn't be seeing them. They should be going off to see a specialist. But you can advise on lifestyle. Are they drinking loads of coffee? Are they smoking? Are they taking cannabis? Are they taking medications that might be causing issues? Have they got a bit more weight around the middle? Don't we all? That might be causing problems with their testosterone. Has anyone ever done a male hormone profile? So it's actually, we are able to advocate and care for our patients. So I would suggest that suggesting they either go privately or they go to an andrologist who can deal with fertility. If they look like the semen analysis looks okay, but they've still not got pregnant, why is that? Do a DNA fragmentation. So how do you make it better? We've talked about lifestyle. You want to make sure that, first of all, it's diet before supplementation. However, you want to make sure you're eating all the colors of the rainbow, all the stuff that Tim Spector says about making sure you have 30 different types of nuts, seeds, fruit, veg, etc. per week are ideal. Reduce your alcohol. If you drink more than 4 units per week, you drop your fertility by 40%. Do not drink alcohol. Antioxidant supplements. People love a supplement because they think, oh, if I take this pill, it'll solve my problem, but you can overdo it. If they take too much antioxidant, it pushes the person into redux. If you're in redux, you get the same problems with sperm. So making sure that people aren't overdoing it, they're taking a sensible amount of vitamins. And generally, there are some vitamins that are good for health in general. C, E, Q10, zinc, and selenium are generally positive. They're going to reduce your oxidative stress. They're going to improve your DNA fragmentation in general. If, however, they've got a varicocele, they need to be seeing the surgeons. They need to have that repaired. Over a long time, a varicocele will start to damage the Leydig cells that make testosterone too. So it's not just damage to the testicle that's creating sperm, it's also the environment that creates testosterone. And I know lots of my patients who've had a long-term varicocele have come to see me after their fertility journey for testosterone replacement therapy. And finally, you may need ICSI, where you're actually injecting sperm because actually you're having to select the least damaged sperm if someone's got severe DNA fragmentation or severe morphology abnormalities. Varicoceles, I've kind of talked mostly about that. I'm going to pop over here now. It's kind of like a blood vessel radiator that bakes your testicle. Your testicles hang outside the body because sperm is made best at 34 degrees centigrade, 3 degrees cooler than body temperature. So if you're baking the testicle and it's now 37 degrees or higher, and you have thick thighs, which I know save lives, but they are heating your testicles. If you're sat down with your laptop on your lap, it's heating your testicles. If you're a grandpa like me and have a heated blanket, you are cooking your testicles. These are all things that we can advise our patients to avoid. So, and what's the problem with it? We've talked about the numbers, but increased heat stress increases your oxidative stress. Increased oxidative stress damages membranes. It damages DNA. It's not good for sperm. And the larger ones, as I've said, cause problems with testosterone production. So what do we do in primary care? First of all, take a history. We're good at that. Hopefully, we can do the golden minute. I'm not sure I can all the time. We can let our patients talk and tell us about themselves. But the main questions are lifestyle. What are they drinking? What are they eating? What are they smoking? Toxins, have they had mumps, etc.? Have they been taking finasteride? Are they taking minoxidil for their hair loss? And we'll talk about that later. Are they overdoing their supplements? So ask them to list them. Once in clinic, I got a 5-page summary of the supplements a person was taking. They were following, I don't know if you've seen that slightly strange man that looks very pale, who's a billionaire, who's trying to live to be like 1,000. Who takes the blood of his son and injects it into, it all seems slightly vampiric. But anyway, he just looks rather well. Are they overdoing these supplements? And this is what he suggests. Anabolic steroids, any previous anabolic use is bad for the testicles. Have they had any exposure? Has their mate Gary at the gym given them something that is less than ideal? Please ask about it. Then we examine our patients in general. Get their waist circumference. If their waist circumference is over 102 centimeters, that means they've got increased risk of lower testosterone, increased risk of diabetes, increased risk of cardiovascular disease, increased risk of 22 different cancers. It's not ideal for you. So if you can get them to try and lose a bit of weight, their testosterone will go up, their fertility will generally go up as well. Do they have any problems with their testicles? How many of you can convincingly examine and find a varicocele? Please raise your hand. That's one person, two people. Okay, good, congrats. Because when I started my job doing fertility, I was like, can I actually do this? So actually, I have learned extensively how to, and it just takes repetition. You get to understand what a normal cord feels like, and then what it feels like when it's a bit thicker than it should be. And that's the only way I can tell, because it feels a bit thicker. It's only when they're grade 3, and honestly, you just feel like you're holding straws in your hand, that you realize, ow, that is what I've been feeling. So I think getting the practice in early, if you're a trainee, please do that now. If you're a female trainee, you may see less men, but do get the chance if you can. Then do we ultrasound them? So the other thing to mention is, are the testicles of adult size? Are they a bit small? Are they a bit squishy? All of these things matter. And then doing an ultrasound. We can also add a male hormone profile. What is their testosterone level? The testosterone level in the testicle is 100 times higher than our blood levels. So if our blood levels are low, our testosterone levels in our testicles will be low. You need high levels of testosterone for adequate spermatogenesis. So if it's low, we need to think about ways that we might help. And this is obviously specialist, but they might be offered clomiphene to increase their levels of FSH and LH, or they can in some people be offered Menopur, which is LH and FSH injections to try and improve their testosterone and their sperm count. What else to do? Semen analysis. Get them to delay, so abstinence for intercourse for 1 to 2 days max. No more than that, because sperm goes off after 2 days. After 4 days, it's less good quality anyway. So if you're having sex, do and try and have sex 2 to 3 times a week. That would be great. Those people that are having sex 2 or 3 times a day, that's probably going to reduce the sperm count slightly. Generally, though, if you're having sex every day, the quality of your sperm goes up, the number just goes slightly down. So it kind of evens out, really. And remember, animals don't know when to stop. So it's not like nature puts a brake on it anyway. Finally, doing a broad-ranging urinalysis. PCR. Now, this, in general practice, doesn't include ureaplasma, and for men, generally doesn't include Gardnerella, both of which significantly impact the microbiome. They increase inflammation, and we have found treating these patients has had a significant benefit in improving their fertility. The problem is we don't test for it, and we really should be if we're worried about someone's fertility. So, and then what do we do normally in general practice if we find there's a problem? We explain it. I'm sure all of you have had a patient come back from a secondary care appointment and go, I have no idea what the doctor said to me. Can you explain this letter, please? And I think we are very good at explaining what's going on. So if there's abnormal findings, explain them to the patient. If you find there's abnormal, I've had patients sent back to me going, this is completely normal. And the form itself, the semen analysis, has 3 abnormalities on it. And it literally says it. And you're thinking, who isn't looking at these properly? I get we're all busy, but actually understanding what we're looking at is really key. So we repeat the test. If your semen analysis is abnormal time 1, do it again. Check out the lifestyle interventions. Do they need to exercise a bit more? Do they need to lose weight? Do they need to eat differently? Do they need to stop smoking? Do they need to drink less coffee, etc., etc.? And if we can, look at DNA fragmentation and Y deletions. Generally for that, you're referring on. I recognize that. If you find a testicular abnormality when you're examining them, oh my God, I'm so sorry, that's me. If you find a testicular abnormality when you're examining them, refer them. If they've got small, soft testicles, have they got Klinefelters? Did they have to have an operation to bring them down? Have they had past testicular cancer? Have they had chemotherapy? Chemotherapy damages all rapidly dividing cells, which is kind of the point of it. Unfortunately, if you're making 1,500 sperm per second, you're making a huge number of sperm as well. So you get damage and reduction in fertility after chemotherapy, after radiation therapy. So these people should be referred. And then finally, infections. If they come back positive for an infection, treat them. But ideally treat both partners, because otherwise they're just seeding each other and it's going to shuttle backwards and forwards. Check that it's disappeared. You could consider microbiome testing. I imagine no one in general practice is looking at that. That will be weighted for the urologist team. I completely understand that. And again, if it's infected, wait 3 months, because it takes 74 days for you to make a new batch of sperm. So if you make any changes to lifestyle, redo it 2 to 3 months later. Okay, then you're looking at the new batch created under better optimum conditions. Do not bother repeating something a month later if you're looking to see improvement. That's not going to make any difference. So what else can we do? We do all of this and we do it brilliantly. So let's focus on that. The Mediterranean diet, God, it's boring. Olive oil is so expensive these days and I'm banging on about it. However, it is really important. A low meat, high vegetable, fruits, nuts, seeds, legumes, etc. environment is ideal for our bodies. I'm sure lots of you have seen the study that came out recently that was done in America. If you are 20 years old and you start the Mediterranean diet, you will live 10 to 15 years longer. If you start when you're 40, you will live 5 to 8 years longer. If you are 80, you will live 3 years longer. Everyone should be on the Mediterranean diet. I think. Yes, everyone. I think pretty much everyone should be on the Mediterranean diet. It increases most factors of fertility. So it's very important for our health in general. Weight loss improves our fertility in lots of different ways, but equally by improving our testosterone levels. If we come over here, these open circles are weight loss derived from diet and exercise, the kind of old-fashioned way. These closed circles with a bit of graying are basically bariatric surgery-derived weight loss. So you can see that generally natural weight loss takes maybe you can get up to 15% of your body weight down, which is really quite tricky, but more often it's 5 to 10% that you manage to lose. But still, your testosterone can go up by 4 units, and that might be enough to push you into a normal testosterone level. If you're on the Ozempic injections or the Wegovy or the Mounjaro, I'm not trying to brand provide here, but if you're on any of these, you can now lose an equivalent amount to bariatric surgery. And so your testosterone level can jump up significantly. And that's why I would much rather we did diet, exercise, lifestyle than jumping to other interventions if we can. This is heat stress. So if someone wanders around wearing basically a costume for work, and by costume I kind of mean like heavy overalls, or they're wearing protective material, they are baking their testicles. If they're wearing tight lycra when they go to the gym, and they go to the gym a lot, they're going to bake their testicles. If they're a cycling warrior and love the lycra for lots of reasons, they're going to bake their testicles. So it's not ideal for them. So watching TV, being overweight where the fat gets deposited above the pubic bone in the thighs, it's going to heat your thighs. And if you have this heat stress, you will damage sperm production. You'll have higher levels of oxidative stress. You will get DNA damage as well. And then mobile phone use. I've got my mobile phone. I don't need my testicles for fertility, so we're fine. However, some of you might, so I just suggest moving your phone into a nice little man or woman bag over your shoulder or something like that. All exercise is not equal. If you cycle for more than 90 minutes per week, you reduce your sperm count by 34%. So take it easy. A light cycle is delicious. A light jog is lovely. If you are running at high levels, so for example, this is over 100 kilometers per week, you're going to get reduction in all semen parameters. If, however, you run maybe 40 kilometers per week, no change. They're not affected. However, if you run on a running machine, on a treadmill, for 30 minutes, 3 times a week, which even I could probably manage, you improve all your sperm parameters. So moderate exercise on a regular basis is key. Do not do high intensity classes. Your cortisol goes up, which damages all your health systems. Do not do HIIT for fertility. You might want to do it for cardiovascular training and for other reasons, absolutely, but you do not do it for fertility. Medications. This is our stock in trade, right? If there is an option to choose a medication that's more appropriate for their fertility, please do. Opiates and benzos will be very negative for the male hormonal system, which will then also have an impact in terms of fertility. Try an NSAID. I appreciate you want to minimize their gut bleeding, so obviously these may not be appropriate for every patient. If you need to sort someone's blood pressure, can you choose one that's a bit more fertility friendly? And then finally, can you choose a statin? Basically anything but Rasuva seems to be a fine for fertility. So just thinking about that. Hair loss. So it's too late for me. I still get loads and loads of Instagram posts asking me, should I replace my hair? Well, where from? My back? It's not like there's much left here either. So lots of young men are taking finasteride. we know that testosterone is converted to DHT via 5-alpha reductase, and it's done within the tissues that it affects. So it's done within the terminal hairs, and the hairs get shrink and shrink and shrink. So unfortunately, by the age of 16, I had a bald patch, and I had frontal balding, which is not the dream when you're fat and bald at a public school. But what this means is these days, lots of people are taking tablets, they're using shampoos, they're using gels, which contain finasteride, they contain minoxidil. Finasteride blocks the breakdown of testosterone into DHT, so your testosterone levels goes up, which is great. DHT levels go down. In general, DHT doesn't really do that much for men after puberty, apart from increase their prostate size. Some people are still sensitive to it, which can then cause menopausal symptoms like depression, etc. But the majority aren't actually that sensitive to a lower DHT environment, which is why most men with propecia taking the tablet for hair loss will feel mostly fine. The issue is the shrinking that's going on here, the lack, your prostate will shrink without DHT. And if we remember, the prostate creates lots of the seminal fluid. And if you've got very poor seminal fluid quality, you are less likely to have sperm that are going to live in the vaginal environment. In a tissue or on the floor, sperm live about 30 minutes. Inside the human body, they live up to 7 days. So clearly the environment is key. So I think that actually finasteride is doing some significant damage to some people. It's not everyone, to some people. But we do know that virtually everyone on finasteride will have a lower sperm count. It's just, it generally bounces back once you've stopped it. But if you've been taking this for 20 years because your hair started falling out at 20 and you start to try and have kids at 40, what has happened to the size of your prostate? You get glandular tissue changes, you get testicular function changes, you get reduced libido, increased oxidative stress. The Baylor University in the US did a study on finasteride, and they found it causes 3,500 separate genetic changes in the human genome. What the hell do these do? I mean, I used to think drugs were clean. They would just affect one thing and they would have one outcome. How naive I was. And then the consequences of infertility. What happens when people have been trying and they've spent all their money? One of my best friends, she was lucky enough to inherit £100,000 from her grandfather. Her brother inherited the same amount. He bought a lemon farm. She had 15 cycles of IVF. Okay? It's an absolute outrage of how much it costs, and it still hasn't got better. So the relationship pressure is huge. Trying to get your partner not to smoke, not to drink, having those conversations for years and years and years. Every time there's a miscarriage, that feeling of hope that you're pregnant, the feeling of desperate loss when it doesn't work out. The fact you're trying to get pregnant, you get, hop on, it's ovulation time. You've got to have sex 3 times the next 3 days. It's not sexy. The lack of intimacy is a problem. So you get sexual dysfunction as a secondary event. And then there's blame. You didn't stop smoking, so we never had a child. And it becomes a real problem on our own. And we can hopefully understand that in our patients and be able to refer them. Thank you.